Hi, I'm Dr. Nicola Mercer. I'm your Medical Officer of Health and CEO of Wellington Dufferin Guelph Public Health. Welcome to this agency. While there are many routes which a person can become the Medical Officer of Health, however, all the routes must fulfill the legislative requirements. So in the legislature it says what qualifications must an individual hold to be the Medical Officer of Health. The first qualification is you have to be a physician. The second qualification is you have to have additional training. Now, my training personally is not traditional. I came as an anesthesiologist to the city of Guelph, and I worked for 15 years, some of that as the chief of the Department of Anesthesia. I also have a Master's of Business as well as a Master's of Public Health. More traditionally, however, you would find that medical officers of health would have a fellowship of community medicine and public health. The health system for public health is designed based on health units. There are 36 in the province, and each one of them is organized and run such that the medical officer of health is the head of the health unit. So the obligated municipality is defined under the Act, and we have 3 obligated municipalities, the County of Wellington, the County of Dufferin, and the City of Guelph proper, as the name of the health unit describes. An obligated municipality means that they have the right to appoint people to the Board of Health. In our case, the County of Wellington has 3 appointees, County of Dufferin 2 appointees, and the City of Guelph 3 appointees. In the case of budget, for instance, at the budget process for health, what we do is the province provides grants to a certain percentage of our budget, up to 75%, and the obligated municipalities have to pay the rest of the share based on the population proportion that each municipal area contains. The work of public health is guided by a number of documents. So let's start legislatively. The Health Protection and Promotion Act is one of the most important acts that guides the work of public health. It's like an overall blueprint of the work that we should be doing. So there are a great deal of legislation, Small Drinking Water Act, that do cover alternate work of public health. But below that, there's also other documents that cover the work of public health. Most significantly, in 2008, the public health standards were brought into effect, and they provide a blueprint of other work that public health must be doing. And then, most recently, the public health organizational standards defined how organizations such as health units should be set up and operate to be organizationally effective in the work of public health. The work of public health is divided into a number of broad areas. Health promotion, health prevention are 2 of the biggest that people think of when they think of public health. Health promotion are all those activities that we do to keep the population healthy, often things that they don't even know are occurring. A very clear example of that is smoking bylaws. So you cannot smoke, for instance, in public buildings, you cannot smoke in restaurants. These are examples of health promotion activities that are being used behind the scenes to help keep people healthier. Health prevention activities are also very important to public health, and classic examples of health prevention activities are our vaccine programs in schools. School nurses offer and provide vaccines to our school children throughout their times when they're in the school system. This provides them with protection when they leave school in their early adult lives. If you visit a restaurant, for instance, you may not be aware that there have been health inspectors at that restaurant ensuring that the food and the practices and processes at that restaurant keep you safe. The work of public health goes on behind the scenes. If you don't see us, that's not because we are not there working to keep the population safe. It means we're doing our job well. So the Board of Health is the governance body for public health. The Medical Officer of Health also sits on the Board of Health as an ex officio member of the Board of Health. They have the right to attend all Board of Health meetings and standing committee meetings, except when, of course, they may be discussing matters personal to the Medical Officer of Health. The Board of Health, in our case, is composed of 15 people. We have 8 municipal appointees and 7 provincial appointees. Board of Health is the governance body for the health unit and is the ultimate decision-making authority, as well as the body that sets the budgetary process and the major decisions for the Board of Health. The medical officer of health has the right to speak at the Board of Health meetings, and I present Board of Health reports on a variety of topics depending on what is information for the Board of Health, what is accountability in terms of the agreements that we have signed with the government, what is topical, perhaps what is of emergency significance, and of course there are routine financial reporting to the Board of Health. This health unit is one of the oldest health units in the province. Wellington County was one of the first, followed by the County of Dufferin, and later in 1967 joined by the City of Guelph. This health unit has been around for a long time, and we have employees here. Some of them are on short-term contracts, but we also have many employees who have served this agency for 25 and 30 years. We hope that your time at Public Health is enjoyable, and if you need additional information or resources, please don't hesitate to ask. We want to make sure that you as an employee feel welcome and needed in this health unit.